Welcome to Heal Through Humor, the podcast designed for you to learn about yourself and laugh along the way. In each episode, we'll explore the healing power of humor as I sit down with guests to talk about mental health, relationships, self-growth, and the ever-evolving world of social media. I'm your host, Talia Bombola. Let's get started. Hello, everyone, and welcome to another episode of Heal Through Humor. Today, we have Dr. Lina Haji with us, and for those of you who have followed both of us for a while, obviously, I'm sure people have seen us comment back and forth. We love hot takes on hot topics. We love to talk crap about misdiagnoses and misinformation, which is vast in today's society on social media. So I'm excited for today's interview, which is a redo because our last one was so dynamic, but it was not salvageable because it was like so many different clips. So we're going to come back at it again, and it's going to be even better this time.
It's going to be even better this time. Thank you so much for having me. And
Yes.
we bonded over the insane amount of misinformation online, which doesn't seem to be going anywhere, by the way.
No, it's not going to leave anytime soon. I think it was yesterday I saw somebody that was teaching, thankfully it was trauma informed, but it was like trauma informed high ticket sales. And I'm like, that feels like an oxymoron. And like, how can you have that if you're like, what? No, like you can't create a sense of urgency for that much cost. Like it goes from that to all the people giving misdiagnoses or people having been in a relationship with a narcissist that now they think they're an expert on narcissism. That's one of my personal favorites, honestly.
Oh, well, one of my personal favorites, because I still do some clinical work. I do a lot of autism and ADHD evaluations, which people don't realize how much testing
goes into getting a diagnosis. Yeah.
How much collateral information, how much data interpretation to truly, be diagnosed with autism and ADHD. And so I'm floored at people being like, and these are young kids who are not malicious, but they're just like, yeah, I was watching a TikTok and it said, if you don't like people, you're autistic. And I'm like, I don't like people and I'm a psychologist.
So I have autism is what I'm hearing.
Yeah, that's not how that works.
Basically, that would be me having autism, apparently, which I think it's so frustrating when there is that much of a misdiagnosis. And I think other podcasts talk about this too, but it's more like, or I think it's other people talk about the misdiagnosis part of it. It's so frustrating because the people who actually need the resources and the people who need that level of care sometimes aren't getting it because people are self-diagnosing based on a misdiagnosis or based on, again, like just misinformation. And it's like, okay, well, we've come too far. There's too much information accessible on social media that's not even accurate.
And not only that, I think people realize that by over pathologizing themselves, they're doing themselves a disservice.
Yes.
Like you're doing yourself a disservice. The treatment is not going to it's not going to work because you don't have that.
Correct.
It might even make you worse. You know what I mean? You definitely don't want to be on Adderall or Ritalin if you don't have actual ADHD. There are serious consequences to misdiagnosis. I mean, imagine
and mismedications. If you're not supposed to be on meds or if you're on the wrong meds. And I thankfully, I hope that when I say this, it doesn't come true, but I know people obviously buy drugs off the streets. Like I've been around a few times. I know that happens. My hope would be that people are not going to be buying like certain psych meds off the streets because it's like, well, my doctor won't give it to me because they don't think I have this diagnosis. It's like,
oh, they are.
They are. Oh, good.
Yeah.
Great.
Yeah.
I was afraid of that.
I work with so many substance abuse, so many people with substance use, and it's like, I've been buying Adderall off the streets for 5 years.
Those ones I've heard of. Yeah. I mean like antidepressants or like maybe. I hope not. Because you don't know what you're getting. And that's true with buying anything off the street and consuming media on the internet. You don't know what you're getting.
Yeah, exactly. It's just as dangerous. And I really think it needs to be emphasized that it's just as dangerous as like a medical misdiagnosis, right?
So true.
Like telling somebody you have migraines instead of a brain tumor. Yes. That's a huge problem.
Yes, it could be lethal. Yeah.
Yeah, it can be lethal.
Yeah.
I think people need to understand that mental health misdiagnosis can be just as lethal.
Yes. And I think emphasizing that, hopefully people who are listening will take that and take it to heart, because it's not, even if it doesn't affect you directly, like you're not the one consuming it, if you've ever shared it, if you see it, if you know it's a misdiagnosis and you're not reporting it, like there's, I think, a due diligence that we all have, especially as mental health professionals, to be cleaning up other people's messes. And that's one of the frustrations I have with the coaching industry. It's not regulated. There's no.
It's not regulated.
Yeah.
You can buy you can buy
Mm-hmm.
an online certification on IG for $19.99 and call
Mm-hmm.
yourself a coach, which has it doesn't mean anything. It's like,
Mm-hmm.
I can call myself a coach right now.
Yeah, same.
And and that means like, don't get me started on that. And it's not just diagnosis, it's so much misinformation. Like
Mm-hmm.
the amount of part of me is like so happy that we finally got to a place where we're trying to remove the stigma and
Yes.
people are talking about mental
I
health.
love that part.
Same. But the over pathologizing, like I had an inmate tell me a little while ago, he was like, I'm bipolar. And I was like, oh, do
Based
tell.
on what?
Yeah. So here we go. Well, I wake up in the mornings and I'm super happy. And then in the afternoon, like people just get on my nerves and then I turn super angry. And I'm like, okay, that's called life. It's called life.
Interesting.
Maybe it's some low frustration tolerance.
Or testosterone shifts in a 24-hour cycle. That's probably it too. Yeah.
You're also in jail. So maybe the jail is annoying you.
Maybe. Yeah.
Because jail sucks.
Mm-hmm.
But that's who, and he's like, well, they told me I'm bipolar. And
Who's
I was like,
they?
and that like, yeah.
And you took it as gospel. Yeah.
And like he's on, and then he's been on like mood stabilizers, which no.
Oh boy.
Yeah.
Not
so
safe if you don't have any. Yeah. Mm.
It's just so bad.
Yeah. No, I think for people who believe they have something going on, go get assessed. I'm not saying don't seek mental health professionals out for, hey, I'm struggling in these areas or I'm doing really well in these areas. I want to improve. Could you just what would you recommend basically? Just like if you went to a general doctor to be like, hey, I need a checkup and they find something and they refer you, please go seek help, but don't do it based off of only I took this quiz on BuzzFeed or I saw this one video that if I sleep with my hands like it's just frustrating because then you hear the information from a professional, or sometimes I've talked to people who have had such a strong case of their own self-diagnoses. We're not talking about the people who actually do a proper medical self-diagnosis where they've been marginalized by medical doctors, but they're like, well, I saw these videos, and they'll be like, oh, I read this article, which is basically code for I saw this TikTok, and they'll
Correct.
go in citing all of the right symptoms, and then the doctor will not do a thorough assessment. So you also want to be diligent that the person you're seeking treatment from is doing their due diligence, is giving you proper assessments. And if you still are like, you know what, this isn't based on TikTok, I feel like there's still something on, go get a second opinion. I'm not saying don't use resources. I'm also don't self-diagnose and then force the providers to give you resources or medicine for something that if they've done a lot of tests you might not have it. And so what else can we help you with coping skills wise? And I think a smart prescriber would refer out to therapy because there could be something going on with limiting beliefs. It could be something going on with self-identity or self-image. I still think it's worthwhile to seek help, but it may not be based on what you think you need.
Right. And that's the thing. I don't want to tell somebody, no, you're not autistic and be dismissive about you're not experiencing stuff.
Right.
But it's you're probably not autistic. Please get evaluated, or ADHD or fill in the blank. But I don't want to dismiss that you are feeling like something is off.
Yes.
And very well, maybe you have, avoidant personality disorder. Maybe you have some sensory issues due to something else.
Yes.
Maybe you have anxiety.
Yes.
And so it's like, I don't want you to think that just because I'm telling you what you're talking about, you have no idea what you're talking about. So I don't believe that you're suffering.
Correct.
That's not what I'm saying.
Correct.
But like you said, putting somebody who's misdiagnosed as bipolar instead of borderline, they're going to get mood stabilizers versus DBT. And the treatment is going to be, you're going to get treatment fatigue because it's not going to work. You're going to be frustrated. You're going to think something's wrong with me. I'll never get better.
Yes.
And on we go. So it's like, it's so important. And the DSM-5, just because you see the criteria or you hear the criteria or you read about the criteria, you Google it, it's not enough.
No.
It's a biopsychosocial approach.
Yes. Everybody reads those bullet points. They don't read the rest of the 5 or 6 pages plus for each diagnosis. Plus, that's a very, in my opinion, having been trained more analytically, we use the PDM instead of the DSM. I prefer that because it's even more of a holistic view, and it tries to analyze where this could have stemmed from in childhood. What defense could this be related to? Again, that's my preference. I'm not against the DSM. I have to use it sometimes when I do a super bill, but for the most part, and you even look at, I think we talked about this last time, the gender section of it for women, it's like, oh, poor you and your broken sexuality. Or if for men, they're like, poor you and your broken sexuality. And for women, they're like, you just must be so dysfunctional. And it's like, what kind of gender bias is that? They get catered to like, oh, this isn't your fault. But then women, it's like, oh, just tough through it and deal with it. Like, there's so many biases in that book, and it's very antiquated.
I'm sure you can agree that the PDM is not the be all and end all, and the DSM is not the be all and end all.
Definitely
right?
Not. They're guides.
So it's a guide. They're guides. They're tools. But if I'm not looking at the biological history, the psychological factors, the social factors, economic factors, all of that stuff, and that's the thing. You can look at the bullet point criteria of the PDM or the DSM or the ICD or whatever book you use. That still doesn't mean that you meet criteria for the diagnosis. That's why you need one of us.
Yes.
Because we're trained to see the whole picture.
Yes. And ask certain questions that help the individual answering the questions draw, at least for insight-oriented therapy, draw connections. Oh, you mean, yes, technically that is a symptom. However, let's look at the cause. Like you were saying with the migraines and the brain tumor, especially if you went on WebMD, you could see that and you're like convincing yourself of it. And it's like, okay, I don't doubt that you're having headaches. But if I just was going based off the first thing of like, oh, take some Tylenol or take some Motrin, what if you're allergic to that? Like there's so many self-treatments that I think people don't understand, like you were saying, could be harmful. And when you're only looking at, well, I need this diagnosis to fit, or I'm so convinced that I have it, I don't want to hear the whole biopsychosocial, I don't care where it comes from. It's like, it's not a trend. Like, but I unfortunately feel like diagnoses, I've seen it in people's Instagram bios. I've seen it as like, that's part of their identity, which I caution people against that, because what happens when you actually do get the right care and treatment? Let's say you're accurate, you get the right care and treatment and it ameliorates and your symptoms are abated and you don't have any active symptoms anymore. It's very well managed, controlled, in remission, whatever wording you want to use. Who are you? What is your identity then if it's not based off of the diagnoses? And I'm not saying don't inform people that it's like having a true, like being celiac or having a true gluten intolerance, not just not liking it and telling the server you're allergic. Like you genuinely have the allergy. You don't need to lead and make it your whole lifestyle and make it your whole personality.
Right.
Yeah.
And that kind of issue requires therapy, because why do you need that to be your identity? You're probably also a mother, a daughter, a sister, an employee, a student. A self. So that becomes also concerning, especially with the younger kids, because they latch onto this, and then it becomes, and even people with lifelong neurodevelopmental disorder like autism, that doesn't define them.
Correct.
You can, and so and listen, every time I go on WebMD, I'm convinced I have cancer. Right?
I'm going to die. Yeah.
I'm going to die. I have a headache. Well, you have 2 days to live. So
pack up your shit and write your will. Yeah.
But even with psych evals, it's not just a clinical interview. It's not just psych testing.
Right.
I go through medical records, collateral interviews, school records.
Yes.
I talk to your primary doctor. It's a whole thing. Sometimes it's 20 to 30 page report before I can even tell somebody you actually do meet criteria for ADHD.
Right.
And if you're not doing that, or psychiatrist or neurologist or, whatever, like you just.
Yeah, I know.
It's really frustrating.
It is. And would you say that, because you still work in prisons, obviously, or is it one or multiple? Do you get contracted?
So I have my own private practice. So most of the work I do now, thankfully, I'm not in the prisons 40 hours a week. I go in and I go out.
Okay.
Okay. So it's a lot of like competency to stand trial, not guilty by reason of insanity evaluations, juvenile mitigation evaluations, sexual victim evaluations, different things like that. So those are all. Forensics is very specific niche, obviously, but I can't tell you the amount of misdiagnosis in correctional facilities, untrained staff, privatized prisons who hire ARNPs. I don't have any problem with ARNPs. I think ARNPs are great and they're necessary, but untrained, straight out of school ARNPs who aren't necessarily being supervised by a psychiatrist, therapists who simply, just don't have the training, the supervision, the experience. And because, those are people cost less money, to be honest.
True.
And if the prisons are privatized, they're there to make a profit.
Yeah.
So
Yeah, why would they? Even if it is better for, like, if the goal is the best diagnoses, cost should not be obviously a barrier or a factor, but that's not the case, because there's third variable problems to consider, like, well, we could pay this person, but it might be this amount, so we have
right.
it's and I think that happens too when people try to make comments, and I'm sure you dealt with this because we touched on it last time, the like publicized trials of celebrities or publicized trials of famous people, even
Yeah.
if they're not like TV celebrities,
Yeah.
then a lot of people will be making comments, they'll be purporting false information, or they'll
Yeah.
misinterpret or misread data or research. And I was
Right.
listening to a podcast this morning, and it was on Diary of a CEO. Love the podcast. I think he hosts very dynamic guests, honestly. And the person was commenting that the male suicide rate is higher than the female suicide rate, and it's increasing. And I know from my own, like, I'm always a third variable, like, what could be causing this behind the scenes?
Uh-huh.
They choose more lethal means. So
Right.
yes, I would like to see, of the people who choose the same means, what are the rates, so it's actually comparable data rather than it just
Right.
being so generalized. And I think that
Right.
that happens too when I'm curious for you if you see people make bigger generalizations, obviously being a forensic psychologist, where you see people take one piece of data or one part of the trial and run with it, and you're just like
Oh my
head in your
God.
hands. Yeah.
All the time. And
Yeah.
if I'm perfectly honest, I as much as my whole life is true crime, I
Sure.
love true crime. I watch all the
Yeah.
documentaries. I've been doing some true crime TV. I have true crime podcasts all day. It's unwell. It's unwell, and I'm aware.
You're like, I
But
think I'm diagnosed with being
yeah,
obsessed with true crime.
totally. I used to come home from prison in my 20s, and my mother would be like, and I would turn on like Forensic Files. This is
Can't
years
get
ago.
enough.
Don't you get enough of this at work? And I was like,
No.
absolutely not. We have to keep going. And then there's a Jeffrey Dahmer documentary coming out, and I'm going to watch that too. So yeah, it's unwell. I've accepted it. I've embraced it a long time ago. But a prime example of that, and I don't know if you know my friend Dr. John Delatorre, but he
Yes.
works on TV. Yeah, he's awesome. So he was commenting a lot on the Johnny Depp Amber Heard trial.
Mm-hmm, mm-hmm.
And to be perfectly honest, and I'm glad I have insight into myself sometimes, I was somebody who fell victim to picking a side and thinking that, I'm human, and thinking this is the bad person and this is the good person. And it's never that black and white.
True.
Never.
True.
It's and we don't have all the details, and we're just being shown this because it's clickbait.
Of
And it
course.
gets a lot of, everybody was invested in Johnny Depp and Amber Heard. And I found myself with minimal information and social media stuff being like, yep, that's the good one, that's the bad one. And I had to walk back and be like, you don't even know. You have no idea.
And no one was there, even if there's recordings, like, see the third variable. What if the person knew they were being recorded? That would probably influence them to act differently. The only way, and this is, unless we develop the creepiest Big Brother society ever, the only way that we would ever know truly all sides objectively would be like Truman Show level, where it was everyone was filmed all the time, without either with knowing it and they forget, because we see that on TV. That's like an effect that happens, that you eventually forget that, or you don't know it, which is probably the best, like a double. Well, I guess it'd be single blind if the people who are viewing you know it, but you don't know it. That would be the only way to get that kind of true data to make an informed, at least, decision, rather than more of a guided or forced decision based on the evidence that people are being presented. And I think that people don't have, rightfully so, nobody should have that much information about random strangers they don't know, but feel that like parasocial relationship with, where people are so invested as though they're like besties with, in that case, Johnny or Amber. And it's like, my other question for you, based on that trial, I was at the nail salon the other day, and they were playing, somebody was watching it on their phone and their headphones disconnected, and I could hear what was going on. And they were like, and she was histrionic and she was this. So obviously I'm familiar with those, and I don't know enough about her. Like, some of the things I heard, I'm like, okay, like, wouldn't be wrong technically, I guess, for that one specific thing if it fit. I'm curious from your perspective, if you see people who not maybe get misdiagnosed, but they don't have enough data or information, and they just kind of throw a diagnosis. Like, there's some things that I think are indefensible. Like, there's some people that if I were a judge, I'm not, or a lawyer, that if somebody came to me and I were the case, I'd be like, you did it. Like, I can't take this. I literally would feel disgusting as a human if I had to create a case justifying why you whatever killed this kid or why you did, like, that is always part of a fascination. I took a couple forensic biobases of forensics in one other class when I was in grad school because my master's ones were full. So I went to the forensic track.
I think you told me that.
Fascinating. Like the way that you guys look at it differently than we do gave me such an enriched experience that I will be forever grateful for. And it also taught me I don't think I'm a nice enough, or I can't argue without crying enough person, or defend, like I couldn't defend what I would view as the indefensible. I think like my value system would bump up against some of the cases that would be brought to me.
Yeah. And it's interesting that you say that because my sister is a criminal defense attorney in New York. And the first time that she had to defend a rapist, she called me crying. And she was like, I don't know how to, like, he raped somebody. I don't know how to do this. And it was like, you know, had to, you know, and it's a little bit similar for forensic psychologists because I've had to treat or attempt to treat or evaluate people who are, quite frankly, horrifically evil. You know, it's not even diagnostic. Are they, you know, they might meet criteria for psychopathy. I've had guys, serial murderers. I've had very famous serial murder patients. I've had horrible serial sex offenders, pedophiles, molesters. You know, for 22 years, I've had to deal with horrible people. But this is where our training comes in. And I would be lying if I said there haven't been times that I'm like, ugh, I don't want to meet with this patient. Like, I can't stand what he did.
Sure.
I don't like him as a human. He has no, you know, that happens quite often. But at the end of the day, you and I are both trained to be as objective as possible, as non-judgmental as possible, as at least with when we have our clinical hat on. And also, you know, sometimes I look at it as like, okay, this might be a horrible human being, serial killer, sex offender, whatever. But if I don't evaluate or treat, that means they are more likely to reoffend. So
there's a that makes sense. There's
whether
the motivating
you're really
factor.
conservative on the political side or really liberal on the political side, the bottom line is 90% of inmates are coming home. And so if we don't treat them as much as we might hate them, they're going to reoffend. That doesn't benefit anybody.
Yeah, true.
So I have to like look at it like that. And of course, you go home and you're like, oh, that guy's a scumbag, or you know, I hate him, or what he. You know, I would be lying if I said I've never had those. Of course, with experience, you become much more adept at
compartmentalizing.
Boundaries, boundaries, and understand, and not taking it home with you, and not, you know. But you know, even to this day, I get an email from attorneys who's like, hey, I need a defense psych eval for a triple rapist. And I'm like, do I want to take this case? Do I not?
And now, time for an ad break. Hey there, listeners. We're interrupting your favorite podcast to bring you a special message from our friends over at Therapy Swag. Are you tired of the same old boring wardrobe? Ready to add a dash of sass and style into your closet while repping mental health? Look no further than Therapy Swag, your go-to online store for snarky shirts and mugs. Their products make awesome gifts for friends, family, or anyone in need of a little pick-me-up. They are on a mission to break the stigma surrounding mental health. They use humor and creativity to open up dialogue, challenge stereotypes, and remind us it's okay to not be okay. Because let's face it, laughter is the best medicine. So why settle for ordinary when you can stand out with Therapy Swag? Head over to their website today and treat yourself to some snarky goodness. Trust us, your wardrobe and your mood will thank you. Thanks to our sponsor for supporting the show. Now back to your regularly scheduled programming. Because you have a private practice, I don't want to assume. So my question would be, is it similar that you get to decide, minus if you're, I guess, court ordered? Same for us. Like that's the only time we'd have to be doing something by the law. You get to choose who you see or not, right? Or who you would take a case from.
Well, most of my work is actually court ordered, and the reason I love court, the reason I love court ordered work is because I don't have a dog in the fight. Right?
True.
I'm not invested in this, so I'm going to be
You're hired for a specific. Yeah. True.
Yeah. So I'm not for the defense. I'm not for the prosecution. And the judge wants to know something. I actually prefer that because it makes my job easier. Because I'm like, I'm just going to tell the truth. I'm going to type the truth, and that's it.
Here's my report. Do what you will.
Yeah. And I'm in the efforts business. I'm not in the results business. So that I like, but I have gotten hired by the prosecution and the defense, and I do sometimes have to check myself and be like, okay, are you turning into an advocate, especially when it's juveniles and you know that they've been, mom is on drugs, dad is incarcerated, they're selling weed because they had to feed themselves.
Right.
Nobody cares if they show up at school, and I'm typing my report and I'm like, I got to advocate for this kid, and yeah, part of my job is advocacy as long as it's clinically and ethically accurate
Yes.
and
Yes.
appropriate. Right. So, yeah, but I've also had conversations with attorneys where it's like, I'll be honest, I met with your client or my patient or whatever. I met with your client. I did some psych testing, and this, if I write a report, it's not going to help you in court. And they decline the report. They pay me for my time. And, in the long run, my reputation and my ethical standards and the fact that I'm willing to tell the truth, even if it doesn't benefit me or the lawyer that hired me, is worth way more than, maybe getting a couple grand for a high profile eval.
Yeah. It's not, I don't think the money is worth the ethic. I couldn't live with myself.
No, I wouldn't be able to
eat me alive.
I wouldn't be able to sleep at night knowing that, I skewed the data and defended this horrible human because the attorney paid me some money. And don't get it wrong. There are what we call hired guns. We have forensic psychologists who are hired guns and willing to skew the data and be like, I'm not saying that there's a lot of them or that they're, just like they're bad therapists, bad psychiatrists, whatever.
Yes, bad apples exist in every profession.
Right. So I can't do it. I thank God I can't do it. Thank God I have a conscience and my ethics. And quite frankly, I worked way too hard for my license, and my school loans are way too high for me to mess that up for a couple grand.
Yep.
No,
it's a good bumper. It doesn't, like, for some people that alone would be enough for them. For others, they're like, maybe I could for the right amount. And then they think about what you just listed. They're like, definitely not. And then there's people who are like, no, like, even if I didn't have a license to uphold, I still have that internal code of ethics and that internal I feel like law, and this, I'm not meaning to incriminate myself when I say this. I'm just talking conceptually, like, ethics are so much stronger for me than some law. Like, law, I will question more because sometimes it's antiquated. Sometimes it needs to be updated, or I look at it and I'm like, but who does that really serve? Like, that doesn't benefit anyone. Doesn't mean I choose to break it, but there's times where it's like the stop sign thing, if literally no one's there, and I've made like the 1 or 2 seconds, like, I don't fully stop. Like, there's times like that where I'll like, okay, I could have waited a few seconds longer and would have if there were other cars. But that it's like the spirit of the law versus the letter of the law. And I think for therapists, you must, and psychologists, people who are in this field working with literally other people's psyche in their hands, much like a surgeon has somebody's lives in their hands, we do too, except in my view, it's even more dynamic. There's influence that people have, such as yourself and such as myself, but there's also influence in general that people have, telling somebody, like this post I had recently that went viral about bullying. A lot of people are using it as their diaries, which, whatever, it's getting my page seen by more people, so take it or leave it. And it wasn't supposed to be that contentious, but people are going in there and having their own like catharsis or different discussions. And it's like, okay, well, people who bully, they have probably justifications for their own behaviors, but they're not thinking about the recipient of it. So I think having that like holistic view of like, who is going to receive this information and how is it going to hurt or benefit other people? Not everybody has that level of like critical thinking skills.
I was just going to say that. I think critical thinking skills are absolutely vital, and we need to continue to reinforce critical thinking skills, or else the mental health professionals that'll come up behind us will be more susceptible to things like hired gun syndrome or misdiagnosis or things like that. And like you said, I was trained, and I'm sure you were too, that ethics go, our ethics code is more stringent than the law, we go with our ethics, right? We go like right. So, and we explain why we have to abide by the ethics. But just like you, I have an internal, thankfully I have an internal clock to tell, I wouldn't be able to sleep at night.
No, I wouldn't. Because I'm a person before I'm any of the other roles that I have, and I would like to live with myself and my conscience as a person. Yeah.
Especially like you said, we have people's lives in our hands. So if I was to be like, well, he raped 3 people, but I'm going to put on this report that he's not a danger to society, and I know in my heart that he actually is, I'm not sleeping at night.
Yeah.
I'm not.
No. And if other people were to read, and this is where I use the word judgment as like discerning, not as like a negative or a positive. There's no moral spin on it. It's more of, if I were to read that as a report, then I would question you, even if I hadn't met you, because it's also your reputation. And I think that's where a lot of therapists on social media don't realize. Some do and disregard. I would imagine, this is a generalization, it's just coming to me in lifetime, but some don't have that thought of, how are other people going to view this? They do in terms of like, how many viewers is it going to get me or what have you, but they're not thinking of it like, I have real clients in my office. They're my priority. And I filter everything through, if a client saw this, could I justify to them my rationale? Not that I would have to,
100%.
but ethically I would feel compelled to do so if a paying client who I have a rapport relationship with and I'm ethically obligated to give them the best standard of care, if they had a concern about something that I wrote, then yes, I would defend that to them. But I think a lot of people just post or try to get likes or views, forgetting that like, the reason why you have the platform for some is based off of the credentials that you have. And I would not forego those credentials just for clout.
No, 100%. And that blows my mind too, because I'm with you. Like, we have to look at, social media is still completely new, and we didn't have professors that had social media. We're all kind of figuring this out on our own. And we're doing trial and error and stuff like that. And even things like, oh my God, I like this picture of me on my motorcycle. Should I post that? Or like, will a sex offender see it? And is this not appropriate? And it's like, I have to look at it through a lens of like, the whole world can see it. The whole world can see it.
And the whole world is not mentally well.
That is correct. And I don't say that I'm excluded from that either.
Yeah. True. And various definitions of the word mentally well. But some people, some people are on the fringe, and like, they will use influencer, because I'm a parent now, and parents posting pictures of their kids on the internet. And I'm like, no. Like, even in the beginning, this will be clipped out so nobody will see it, but my daughter had to be with me. And no, she's not going to be in it ever. Like, there's no need for her face. Even if babies grow and change, pedophiles exist. And there was a baby modeling agency that I was looking into, that all the pictures of the kids, including their names and stats, like height, weight, whatever, for obviously if people are magazines, they would need that. Still gross, but I kind of get it. Wasn't behind a paywall. And I emailed them and I said, I was going to use your agency, but then I thought about it from a parent and like almost former law enforcement perspective.
Right.
Do you not think pedophiles are real? That like, they could just click on, this was the first site that they would go to. They didn't ever respond, and they didn't change their website.
Yeah, of course you need that information, but that's private information. That's just like,
at least have a password or something where you have data collected. You shouldn't just be able to click on kids and see it. So it's like, being able, I think the best gift that any human, but especially a mental health professional on the internet who has a platform, can give, is being discerning about what am I putting out there, and how is this going to be consumed? And if you're just a parent in general, like, your kid can't really consent to that, and they probably don't want that. And you can see so many people post videos of creepy people commenting and taking it the wrong way, watching kids eat food. Like, it's disgusting. There's disgusting people that also don't have a filter, that go in the comment section and they're like, this seems appropriate to post online. And like, I used to have that comment, not the pedophile stuff, but I used to have, in my view, like, inappropriate or just questions like, why would you put that on the internet for all to see? Like, that's an inside thought. I feel like we should leave some things out of the general knowledge. That's enough internet for the day.
Absolutely. Absolutely. There are no more inside thoughts. And that's the problem, because I think this younger generation, really believes that, and not to knock them, but it's not even their fault. They are born and raised in the social media era, that this is reality and this is the only thing I know. And, even meeting juveniles who have very delayed social skills because they're like this all day.
Yeah.
It's just.
Yeah. It impacts so many things. And I appreciate on your page that you do the Misdiagnosis Monday and you talk about that, and you are a trained professional, and you have the TV shows that you've been on. Like, you have I think that you're using the platform in a way that makes the accurate information accessible and dispels the inaccurate information.
Thank you. I very much appreciate that. And I agree. I think you do the same thing. And you also make me the reason I love your page is because you always make me think.
Cool.
Like you are very kind of outside of the box
Yeah.
with certain things, not in a bad
Yeah,
way, but
yeah.
you make me use my critical, especially since you're like psychodynamically
Yeah.
oriented. I'm like hardcore CBT,
Yeah.
CBT. Um, actually, I was talking about this with Dr. Mack,
Yeah,
revealing
yeah, yeah.
yeah. So we're really good friends. And I've noticed that, you know, at one point in my life, because I was in prison and we have such limited time, limited resources,
Right.
we had to use CBT because it's time effective.
Yes, yes.
You know, yeah. And
Regimented.
you can't open up trauma wounds in a inmate who's already in a dangerous environment. He's going to be more vulnerable.
Correct.
He's going to be more susceptible. And so it was literally a clinical
need.
A clinical need. Mm-hmm. You cannot open this guy's trauma and then he might get transferred to another prison.
Exactly.
And you haven't. Okay, so I was very CBT, and at one point I was very hardcore like behaviorist. Like I don't care how you feel, I care about how you're functioning. And the older I got, the more, which is ironic because when I went into grad school initially, when I did my master's, I was like, it's all about feelings and feeling better. And so
how does it make you feel? Yeah,
we're all gonna feel better. And then, but like, I acknowledge that with time and experience and training and education, that's susceptible to change. And now I'm at a point in my life where I'm like, oh my God, psychodynamic theory makes so much sense. And I'm starting to look at person-centered and emotional focus therapy. And, you know, the research says it doesn't matter what your modality is.
It's the rapport with a therapist. Yep.
Right. And so I'm trying to be less closed-minded and realize that every modality, even if I don't particularly like it, I don't care if it's Gestalt, empty chair, has something to bring to the table. And I didn't used to think like that. I was like, if you're not CBT, you're dumb. And CBT has a ton of limits. You know what I mean? Tons of limits.
Yep. Yeah. CBT is, I'm not a fan of the alphabet therapies, so to speak, like CBT, DBT, EFT. I like some of them. I do think they have their place in conjunction with, obviously by a psychodynamic or psychoanalytic lens, because it's holistic, or the third wave therapy modalities. But with CBT, it like helps you have a better relationship with yourself and your thoughts and your limiting beliefs. And then DBT is obviously dialectic. So it's like the one up of a relational CBT, if you will. There's obviously so many other modalities out there. I think including skills and behavior and understanding why you are the way you are and learning to think differently and ask different questions is like the best blend. And I know I used to do DBT a lot with my clients and I had training in it. I wasn't like certified or anything, but I appreciate the modality. That's just not my lane. And being psychodynamic and analytic and rewiring the subconscious and having people think differently. So I appreciate your feedback because that's what I'm going for, is like people can laugh, obviously, but then they learn something else about themselves, or they're like, oh, I never would have pieced that together. And it's not my job to button it up nicely. It's my job to kind of push a little bit and have people be like, oh, that's uncomfortable, but I want to know more about it. Yeah.
And it's funny you say that because my therapist, who is like a 70-year-old New Yorker guy who's been in mental health for probably like 60 years, he's emotion focused, object relations, probably trained with Freud. God, I hope he doesn't see this. You know, old school.
Yes.
And so it's funny that I chose that because it's the polar opposite of me. He's like feelings, relationships, interpersonal, object relations all over all the way. And I'm like, you're in prison. You need to think different, act different, keep it moving.
Yeah.
Right. So it's uncomfortable for me, which is exactly what I needed. It pushed, it pushed me out of my comfort zone. It pushed my limits. It pushed my boundaries. And sometimes I hate him. And then, of course, when I realize he's right, then I love him again. But that's what therapy is.
And that's quality treatment.
Yes. And we have to acknowledge that I think we need to be less rigid.
Yes.
In terms of, I'm a behaviorist and that's it.
Right.
Okay, there's evidence-based for everything. And like you said, like CBT, I needed to learn to use CBT. I had no resources, no time. There were other factors where it was like, I could only do CBT.
Yeah. Yeah. And so I think the more that we're able to incorporate modalities to give the people that we're working with a holistic treatment, the better. Honestly, I'm a big advocate for pick what works for you and that you're the most skilled at, and what works best for your client, and then know when to refer out. Honestly, that's like the bread and butter of being a good therapist.
I was just going to say that, you know, there's those memes about therapists who have a million things on their websites as their specialties.
Mhm.
Yeah, I love that I have so many people I can refer out to, because I never ever want to pretend I'm the be all and end all.
No.
Neuro, I suck at neuro. I can do autism and ADHD, but any other
Yeah.
neuro, I'm out of here.
Yeah, not your speed.
Yeah, not my trauma. I can do very minimal trauma therapy. I can evaluate for trauma very well. If it's treatment, it's not my thing. And I think people need to be more comfortable saying that.
Mhm.
I don't know how to do this, or that's not my lane, or it's out of my scope of practice, or
Yes.
I'm not trained in it.
Mhm.
Just referring out is amazing. I think that says a lot about you being a humble, ethical practitioner.
Yes, knowing what is for you and knowing what's not for you. And those are the lanes. Like, stay in your lane and refer to the other lane when needed.
That's why we have each other.
Yeah, exactly. Yeah, I if I had the training, I could do what you do, but I don't.
Yeah.
And you already have it. So why would I try to do your job if you're already so good at it?
And I wouldn't be able to do your job at all. Psychodynamic, I barely, I literally remember nothing from class. I'm still like psychodynamic. Wait, there's psychoanalytic and Freud and Oedipus complex and penis envy, and then we move.
You're like,
past
so you
that.
probably wanted to sleep with your dad. The person's like, what?
Yeah. That's all I got. All I got.
Next client.
Yeah,
your mom was weird. Next, yeah.
If you have penis, you'd be fine. And other than penis envy, I got nothing. Have a good day. That's all I got. It's so bad.
I would pay to see that.
That's all I got. But at least I'm aware that that's all I got.
But it's good. I think we need more people who are self-aware in the world.
And just acknowledge that you don't know everything about everything.
True. I know a lot about what I know, and then I also know what I don't know. Yeah.
Correct.
Yeah.
Correct. Yeah.
Well,
things like eating disorders.
Yeah.
I'm not trained in that. I'm not.
No.
I would not want to do that to a patient.
No.
You have an eating disorder. I'm going to find you someone.
You need to get specialized care. I'll do collateral conjunctive work, but I'm not going to be the best person. And private practice is probably not the best level of care, to be honest, for some of those diagnoses.
Agreed.
Well, thank you for such a dynamic discussion. I could talk to you for hours. I would love to have you back on for non-tech glitch related concerns.
Anytime.
And if people want to find you, where are you most active?
Where am I most active? So it's funny because I have to give a talk on social media addiction, but I might send you 1,000.
Art imitates life, yeah.
I can give a talk about social media addiction. I'm going to send Dr. Mac 4,000 memes just today. Okay. So my IG is RISE, RISE, Psychological Services. My website is the same, risepsychological.com. If you want to watch my latest true crime documentary that came out, it's called World's Most Evil Prisoners. I think it was on Paramount Plus.
Yes.
You know what? It's on YouTube now. It's on YouTube.
Cool.
Just go to YouTube. It's free, YouTube. And that's where I'm at.
I love it. Well, I'm going to check into that. Obviously not with my daughter present because it would traumatize her for life. Bonus though, another therapist would have a patient for life. So trade off. No, just kidding. She'll be old enough. I'm not into, I like the true crime stuff, but the movies with like a lot of gore are not my thing. So I will.
Me neither.
Yeah,
me neither.
No, I've watched your show. I'm going to continue to watch because you have more since we last recorded. So I will tune in as well. And then I will see you.
And give me feedback. Give me honest feedback.
Course. Yeah, I'll text you. And then I'll see you on Instagram.
Okay.
All right.
Thank you.
Thank you. Thank you so much for listening to another episode of Heal Through Humor. If you like the show, can you please go on your favorite platform and rate, review, subscribe, all of the terms that we usually throw out. I would really appreciate it, and I would love to get more listeners just like you in front of the podcast. And if you have an idea for a guest, please feel free to DM me at Talia Bombola. I would love to hear from you. Until then, I will see you on the next episode. Take care.